Oh, you said that some people cope with drugs. That's a really big thing. I see that in my hospital a lot, where there's people who don't like taking the medication because the side effects of some of these medications are terrible. Haldol, one of the medications for psychosis and hearing voices and all types of perceptions that aren't there. One of the side effects of Haldol is called tardive dyskinesia, and
Hmm.
that's when they get movements, uncontrollable movements, and that they're aware of, like they're sticking their tongue out or they're doing these weird things or their eyes are doing that right there. It's uncontrollable, and those symptoms can persist even after they stop taking the medication.
Yeah.
So people make the conscious decision, like, okay, I don't want to take that. Maybe maybe this crack pipe is going to help me, or maybe this meth is going to work. And I mean, I would imagine do they, it from your experience, do they see some results from that? And that's why they continue to use it.
Um, it depends. I first off would never advise any of my clients to use any kind of drugs to help with a mental illness. It may work for a short period of time, um, but it always gets out of control and increases those symptoms. At some point, it never ends well. That is not the right way to treat your mental illness. Uh, I know a lot of the side effects from medications that do help manage symptoms have are crazy. The TD is insane and it's very uncomfortable, especially for someone who is trying to just live a regular life. Imagine going to work and, having twitches or rapid eye blinking or any of those things, and you're just trying to live a life and not, show that you're trying to cope with something that's very personal. Um, so I understand the meds don't always work out the best, but drugs and alcohol are not the right way to go. Uh, Always consult a psychiatrist and figure out that med regimen. Sometimes it just takes a little while to get the right dosage, the right combination of meds for it to actually work. So I stick with the meds and lay off the drugs and alcohol for sure. It never ends well.
Amen to that. Amen. So you're saying as a doctor, you've never seen a case where fentanyl or PCP or methamphetamines has actually worked to treat mental illnesses.
Correct. I have never seen a case where someone is using drugs and it has helped in any part of their life: mental health, relationships, employment, uh, you know, friendships, romance, relationships, children, none of it. It always falls to pieces, even if in the beginning it seems like it's working. It is not. It is just fueling up to come crashing down. So I caution very, very strongly against the drug use and alcohol use.
All right, you guys heard it here. You heard it from the doctor herself.